Initially, I wanted to be a veterinarian, but as I was working with a veterinarian, he decided that I may be best off working with people. Just in his own regard, he thought that would be a better direction. So it certainly increased my interest in that. I was interested in the whole field while I was in medical. I was in high school, and then going into college was pre-med, and just maintained that track all the way through. The most serious case complications, majority of what I do, or a lot of what I do, is revision work. So majority of that would be complications and fractures and or loosening of prosthesis. I don't know that I could necessarily say that there's one that was more complicated, but in general those type of cases are very complicated and can take quite a bit of time. Take time in healing and take time as far as surgical endeavors. Altogether is just much more complex. Surgery is what most surgeons live to do. It is a big part of what we enjoy, because we actually are functionally working and skill-wise employing a lot of the things that we developed individually and trying to make those improvements. Most interesting part of definitely of our work is the surgical aspect, but patient care, evaluation patients in office and stuff is very important, and definitely comes along with and seeing improvements after surgery. So it's very satisfying as well as time goes on. Majority of what I do is hips and knees, so as we become more funneled towards our area of specialty, obviously hips and knees are a big part in what I do enjoy doing. I don't know that I would say that any of them are more enjoyable than others. I guess it gets more challenging than others, and sometimes that can be a little more interesting sometimes. Seeing a patient that's truly had a problem and dysfunction, and taking that and transitioning from a disability essentially into a functional capability over probably the course of 2 to 3 months' time, and seeing that drastic of a change that quickly. Start seeing it as you're in training through residency, but certainly becomes more concrete as you're taking care of your own patients and you have a more direct impact on that. Continued change and advancements is probably technology, utilizing patient-specific imagery and navigation has definitely changed some of the surgeries that we do. Certainly some advancements in different approaches has also made recovery times different. All of these aspects, I think, have affected recovery times in general, and even in a short period, a short time frame from when I was still in training, which wasn't terribly long ago, to now. Patient hospitalization, patient stays within the hospital have significantly gone down from 3 to 4 days down to usually overnight stays, which is a huge transition, and that only increases the level of function and the speed of the recovery.